Well, let's talk a little bit more about that CDC travel guidance and other COVID topics with Dr. Stephen Thomas. Of course, he's the Chief of Infectious Diseases at Upstate Medical University. Dr. Thomas, thanks for joining us. Good to see you again. How are you?
Good to see you, Jeff.
So let's start with that one, the latest news from the CDC as they continue to turn that valve open a little more. It's on travel. Go deeper for us. So what does this really mean? What are your recommendations when it comes to travel? Is it just wide open, kind of free for all if you're fully vaccinated, or what should we really know from this?
So I think what the CDC is saying is that they have a lot of confidence in the vaccine effectiveness data that's being shared right now. One piece of that being that the vaccines seem to continue to have effectiveness 6 months after vaccination. Number two, that they're protecting even against asymptomatic infections. Number three, I think they're probably extrapolating that people who are vaccinated are probably less likely to transmit the virus if they do get infected to somebody else. So I think they're really showing confidence in the vaccines. But what it doesn't mean is that even if you are vaccinated, you can still be infected and you could still infect someone else. And so I think this is why they're still encouraging people, if they do travel, to continue to wear a mask, to continue to wash their hands, and to make sure that if you're traveling internationally, you know what the country's requirements are upon entry, because a lot of these countries are still going to require that you have a test within 3 days of departure.
People, Dr. Thomas, will be traveling, whether it's by air or ground or whatever it is, for Easter weekend most likely. What's your guidance when it comes to get-togethers, dinners, things like that? What would your recommendation to people be?
Yeah, I mean, for this weekend, I would still keep the numbers of people who are gathering small. I would keep it to people who you know. Preferably, it would be kept to people who are all vaccinated. Anyone who can be vaccinated, hopefully they will be. And if you're sick, I wouldn't go to the gathering. So I think people still need to screen their own health prior to attending an event. So that, that's my general guidance. It's been kind of the same steady guidance that I've had for the last 6 months, but I think it still applies.
Sure. Speaking of getting together, as more and more people get vaccinated here, I'm going to throw a scenario at you here. You've got two families, whether they're related or they're neighbors or whatever. All the adults are fully vaccinated, maybe 4 parents. The kids are younger than 16. They're obviously not vaccinated at all. What can they do? What should they not be doing? What's your recommendation, advice there?
Yeah. Again, if anyone in those families are ill, I would not attend, the event. I wouldn't gather. And in the scenario that you mentioned, so there's a lot of positives there. So again, we know that people who have been fully vaccinated, even if they do get infected, their risk of having a severe infection, the risk of hospitalization, and certainly the risk of death is dramatically cut, greater than 90%. So that's good. We also know that kids who do get infected, the vast majority of young children who do get infected really don't have a problem. If there are kids that have certain conditions, problems with their immune system or other conditions that make them at high risk, I would think twice about that. But I think 2 families where all adults are vaccinated, that's a pretty good scenario.
More great news you mentioned a little bit earlier, though, from Pfizer this week, actually showing and saying studies show the vaccines protective for at least 6 months, probably even longer. Is that because we're just getting more data in, or what does that all tell you?
Yeah, no, that's exactly it. So you may recall, seems like a lifetime ago, but we started vaccinating people back in July of 20. So you can do the math, right? We're at least 8, 9 months out from that time point. So that 6-month data has clearly rolled in, and my guess is that both Pfizer and Moderna are going to go to the FDA relatively soon to share that data with them. So it means that protective immunity is persisting. That's a good thing. The second thing is that they also released data that showed very positive protection in 12 to 15-year-olds. So that's great. The other thing, which was kind of in the smaller print, but it's very relevant, they're starting to show very positive data against some of these variants as well. So it was a good week for COVID vaccines.
Last one for you. What are you expecting as many families who may have gone on spring break, especially just some hotspots? We know some people went to Florida, things like that. They're going to be coming back. Kids are coming back to school on Monday. Some districts are getting them more in person, into classrooms, closer together. What are you expecting as we go forward here Monday and in the next couple of weeks?
Yeah, so in regards to the K through 12 classroom situation, my feeling is the same. If people are being screened prior to coming in, if they are wearing masks while they're at school, if they're avoiding large gatherings as much as they can, and kids are washing their hands, I think school is a very safe place for kids to be. You know, the scenario of people having already been now with, you know, spring, like you said, spring break ending and people returning to their hometowns, you know, people are going to know how they behave themselves when they were there, and they know if they were in a hotspot. So Florida, for example, most of the 12,000 variants, you know, that we have seen in this country so far of that UK variant, a lot of them, thousands of them have occurred down in Florida. So I'm hoping, you know, people do a little check of themselves and say, you know, geez, if I feel ill, I probably shouldn't go to work or school or to a friend's house, and I should get, you know, I should get tested.
Dr. Thomas, you know, we really appreciate your time. Thanks for joining us tonight. We'll see you again really soon. Have a good weekend.
Thanks, you too.